Moxifloxacin Hcl is a medication used to treat bacterial infections. It belongs to a class of drugs called quinolone antibiotics and works by stopping the growth of bacteria. It is important to note that this medication only treats bacterial infections and will not work for viral infections such as the common cold or flu. Using this antibiotic when it is not needed can cause it to not work for future infections. It is important to follow the recommended dosage and take it at the same time each day for the best results. Always consult with your doctor about the best timing to take this medication. Before taking moxifloxacin, make sure to read the medication guide and, if available, the patient information leaflet provided by your pharmacist. If you have any questions, don't hesitate to ask your doctor or pharmacist. You can take this medication by mouth with or without food, as directed by your doctor, usually once daily. The dosage and length of treatment will be based on your medical condition and how you respond to the treatment. It's important to drink plenty of fluids while taking this drug, unless your doctor tells you otherwise. Make sure to take this medication at least 4 hours before or 8 hours after taking other products that may bind to it and decrease its effectiveness. Some examples of these products include quinapril, sucralfate, vitamins/minerals, including iron and zinc supplements, and products containing magnesium, aluminum, or calcium, such as antacids, didanosine solution, calcium supplements. For the best results, take this antibiotic at evenly spaced times. Try to take the medication at the same times every day to help you remember. It's important to continue taking this medication until the full prescribed amount is finished, even if your symptoms disappear after a few days. Stopping the medication too early may result in the infection coming back. If your condition lasts or gets worse, be sure to inform your doctor. If you experience nausea, diarrhea, dizziness, lightheadedness, headache, weakness, or trouble sleeping, it's important to tell your doctor or pharmacist. Remember, your doctor has prescribed this medication because they believe that the benefits outweigh the potential side effects. Most people using this medication do not experience serious side effects, but it's important to contact your doctor if you notice unusual bruising or bleeding, signs of a new infection, changes in urine output, signs of liver problems, or very serious side effects like severe dizziness or fainting. Moxifloxacin Hcl may rarely cause a severe intestinal condition, so it's crucial to contact your doctor if you develop persistent diarrhea, abdominal pain, or blood/mucus in your stool. If you notice white patches in your mouth or a change in vaginal discharge, it could be a sign of a new yeast infection, and you should contact your doctor. While a severe allergic reaction is rare, it's important to seek medical help immediately if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. If you experience any other effects not listed, make sure to contact your doctor or pharmacist. And in case you have to need to report side effects, contact your local health authority for guidance. Quinolone antibiotics, like moxifloxacin, have the potential to cause serious tendon damage, nerve problems, and nervous system issues. Seek medical help immediately if you experience symptoms like pain, numbness, burning, weakness in your arms or legs, changes in sensation, severe headaches, vision changes, shaking, seizures, or mental/mood changes. Tendon damage may occur during or after treatment, so if you develop joint, muscle, or tendon pain or swelling, stop exercising and seek medical help. Those over 60, taking corticosteroids, or who have had an organ transplant are at greater risk for tendon problems. This medication may worsen a muscle condition called myasthenia gravis. Contact your doctor if you experience new or worsening muscle weakness or trouble breathing. Before using this medication, discuss the risks and benefits with your doctor. Before taking moxifloxacin, it's important to talk to your doctor or pharmacist if you are allergic to it or other similar antibiotics. This product may contain inactive ingredients that can cause allergic reactions, so be sure to discuss any allergies with your pharmacist. Before using this medication, make sure to tell your doctor or pharmacist about your medical history, especially if you have diabetes, heart problems, joint or tendon issues, liver disease, mental or mood disorders, myasthenia gravis, nerve problems, seizure disorder, high blood pressure, certain genetic conditions, or any conditions that increase your risk of seizures. Moxifloxacin may affect the heart rhythm, so be aware of any symptoms such as fast or irregular heartbeat, dizziness, or fainting. It's important to inform your doctor of all the medications you are taking and any medical conditions you have, as this can affect the risk of heart rhythm issues. Low levels of potassium or magnesium in the blood can also increase the risk of heart rhythm problems, so discuss this with your doctor if you are using certain drugs or have conditions that may affect these levels. This medication may rarely cause serious changes in blood sugar, especially in people with diabetes. It's important to monitor your blood sugar regularly and be aware of symptoms of high or low blood sugar. If you experience any of these symptoms, contact your doctor immediately. Moxifloxacin can also make you dizzy, so it's important to avoid alcohol or marijuana while taking this medication. Be cautious when driving or using machinery until you know how this drug affects you. This medication may also make you more sensitive to the sun, so be sure to limit your time in the sun, use sunscreen, and wear protective clothing when outdoors. It's important to inform your healthcare professional if you are using moxifloxacin before having any immunizations or vaccinations, as it may affect the effectiveness of live bacterial vaccines. Before undergoing surgery, make sure to inform your doctor or dentist about all the medications you are taking. Children may be more sensitive to the side effects of this drug, especially joint or tendon problems, while older adults may be at greater risk for tendon problems, heart rhythm issues, and a sudden tear or break in the main blood vessel. If you are pregnant, use this medication only if clearly needed and discuss the risks and benefits with your doctor. It is unknown if this drug passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with Moxifloxacin Hcl. This can change how the medication works and increase the risk of serious side effects. It's important to keep a list of all the medications and herbal products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Moxifloxacin Hcl include blood thinners such as acenocumarol and warfarin, as well as strontium. It's also important to note that many drugs besides moxifloxacin may affect the heart rhythm, QT prolongation, including amiodarone, dofetilide, procainamide, quinidine, sotalol, and ziprasidone, among others. Always consult your doctor or pharmacist before taking any new medications alongside Moxifloxacin Hcl. If someone has taken too much Moxifloxacin Hcl and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Remember, do not share this medication with others. Moxifloxacin Hcl has been prescribed for your specific condition, so do not save it for later use when you have another infection unless your doctor advises you to do so. It's important to have regular medical and lab tests while taking this medication, including tests for liver function, complete blood count, and blood glucose. Make sure to keep all your medical appointments and consult your doctor for more details on how to manage your condition effectively. As for the daily dosage, it is important to follow your doctor's instructions. Typically, Moxifloxacin Hcl is taken once daily, with or without food. The best time to take it is usually in the morning or as directed by your healthcare provider. In terms of the benefits, Moxifloxacin Hcl is effective in treating a variety of bacterial infections, including respiratory tract infections, skin and soft tissue infections, and certain types of pneumonia. It works by stopping the growth of bacteria, helping to alleviate symptoms and improve your overall health. If you forget to take a dose of Moxifloxacin Hcl, take it as soon as you remember if it is 8 hours or more until your next scheduled dose. If it is less than 8 hours until the next dose, then you should skip the missed dose and take your next dose at the regular time. It is important not to take a double dose to make up for the missed one. This medication should be taken exactly as prescribed by your healthcare provider. Make sure to store Moxifloxacin Hcl at room temperature, away from light and moisture. It's important not to store it in the bathroom and always keep it out of reach of children and pets. When you no longer need Moxifloxacin Hcl or it has expired, make sure to properly discard it. Do not flush it down the toilet or pour it into a drain unless instructed to do so. You can consult your pharmacist or local waste disposal company for the proper way to dispose of it. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.